Hi, this is Dr. Peter Grinspoon from Grinspoon on Drugs. We're going to be speaking today about the topic, is cannabis addictive? If you like this content, please subscribe to my YouTube channel by pressing the button at the bottom of your screen. Now, the question is cannabis addictive? It depends who you talk to. On the one hand, you're the cannabis advocates. A lot of them, who I'm very close friends with, think cannabis isn't addictive at all, and that the whole concept of cannabis addiction was a feverish propaganda point of the US government. On the other hand, you have the addiction psychiatrists. I work a lot with the addiction psychiatrists. We are completely on the same page about opiates and alcohol, and they just do a great job. But I don't think they understand cannabis very well. And I think they've been sort of part of the US government's propaganda campaign against cannabis for the last 70 years, not on purpose, but I think they sort of mindlessly repeated a lot of the government's myths and still truly believe them. Many of them don't necessarily even think of cannabis as a medicine, which is pretty out of date, but this is changing. They're heading in the right direction. But anyways, if you talk to the addiction psychiatrists, they say 10 to 30% of adult cannabis users are addicted to cannabis. Now, if you give someone a definition of addiction, who doesn't have an addiction, you're actually harming them because people get treated with stigma, with judgment. Studies have shown they don't get given as many pain medications when they're in pain, which is awful. So why is there such a dichotomy between what the cannabis activists think and what the addiction psychiatrists think? I think one good place to start is the definition that we have of cannabis addiction. Now, we refer to the addiction psychiatrists about this. And again, I think it's a little bit of a weakness because I don't think they really understand cannabis that well because they've only been exposed to this negative bubble of cannabis information. But there are 11 criteria that you have to satisfy to have an addiction to anything, to opiates, to benzodiazepines, to alcohol. And there are 11 criteria. And if you have two of the 11, you have an addiction. And these are things like driving under hazardous circumstances, intense cravings, using more that you intended to use, being unable to stop. I mean, some of these are very reasonable and certainly would apply to any addictive substances. But with cannabis, two of the requirements to get addicted are tolerance and withdrawal. Withdrawal meaning of withdrawal symptoms when you stop the cannabis, and tolerance meaning you need ever increasing amounts to reach the same effect. Now, it's really interesting. So if you just have tolerance and withdrawal, you have a cannabis addiction, according to the addiction psychiatrist. But there's an exclusion for diagnosing opiates. For example, if you have an opiate that's prescribed medicinally, like if your doctor gives you a prescription for opiates, tolerance and withdrawal don't count to the addiction because everybody gets tolerance and withdrawal with opiates. So why diagnose an addiction if someone doesn't have an addiction? But the same is true for medical cannabis. Most people on medical cannabis get tolerance and withdrawal. They are a physiological component of taking the medication. They have nothing. They can be a component of addiction, but you can't diagnose addiction with just tolerance and withdrawal. Again, that's why with benzodiazepines or with opiates, if a doctor prescribes it, it doesn't count. But we don't have this exclusion with medical marijuana. And again, most medical marijuana patients get tolerance and withdrawal with many other medications. We get this with like our SSRIs, again, our benzos, our opiates. So the fact is that the addiction psychiatrists who don't fully believe that cannabis is a medicine don't provide the exclusion about tolerance and withdrawal, even if the marijuana is prescribed by a doctor. Now, in this case, there are 4 million official medical marijuana patients, and the actual count is probably in the tens of millions because tens of millions of people use it, and most people use it medically. So when we include tolerance and withdrawal to a cannabis addiction without differentiating who's a medical patient, who's a recreational patient, we end up roping in all the medical patients and giving them an addiction. So what we're doing is we're pathologizing needlessly these medical marijuana patients. We absolutely need a different rubric, a different definition of addiction for cannabis addiction. I think that we should have 9 criteria instead of 11 and not use tolerance and withdrawal because that's nonsense. And if you have to have 4 out of 9 instead of 2 out of 11, you'd really be diagnosing those people who need help. A certain percentage of people who use cannabis use it addictively. The way I describe addiction is continued use despite negative consequences. I have a patient who has cannabis hyperemesis syndrome, which is another video I did, and they can't stop smoking cannabis enough. The way to differentiate cannabis hyperemesis syndrome from something very similar called cyclic vomiting syndrome is to stop the cannabis for 3 months and see if it goes away. If it goes away, it's the cannabis. If it doesn't go away, it's another problem. So this patient can't stop using cannabis even for a month or two, and he's spending several nights a month in the hospital getting intravenous medications for nausea and barfing his brains out. To me, that's addiction despite negative consequences. People do get addicted to cannabis, but it's not the 10 to 30%, no way, of adult users that the addiction psychiatrists claim. So it's an issue of heavily debated territory. And I'm on the side of saying, yes, people get addicted to cannabis, a certain percentage do. Yes, they can smoke away their lives. Yes, it can be dangerous, damaging, and destructive. And yes, people with cannabis addiction need to be treated with empathy, compassion, and skills. But no, it's not a third of medical patients. Thank you so much for listening today. I hope you found this content helpful and interesting. If you have any loved ones that are suffering from addiction, or if you have any questions about addiction or cannabis, please feel free to leave a comment or please check out my website, petergrinspoon.com. Thank you again for listening.